Please welcome Dr. Trine Stub.
Okay. Good morning, everyone, and thank you for the introduction and the opportunity to present the part of my doctoral thesis for you today, which I have called Safety of Treatment Provided by Homeopaths, with the subheading Homeopathic Aggravation, Adverse Effect and Risk Assessment. In this presentation, I will start with some general thoughts about patient safety and and patients' rights and the obligation to do no harm. A case history will be presented with the dictum to do no harm was heavily violated. Further, the understanding of patient safety and risk in a research plan will be presented. And this presentation will be divided into two parts. First, I will give you some data from the focus group interviews with medical and non-medical homeopaths. And then I will say something on risk in homeopathy regarding possible pharmacological effects and potential explanation for homeopathic aggravation will be suggested. And some facts about homeopathy. Homeopathy is usually used by a considerable proportion of the population in Europe. The 12-month prevalence of those who consult homeopaths vary between 2% in Great Britain and 15% in Germany. And the prevalence in Scandinavia is between 7 and 14%. From observation studies, we know that homeopathy is a treatment system that is connected with high patient satisfaction among patients. And research reveals that patients consult homeopaths with different types of diagnoses and problems. Men seek treatment for allergy, women with migraine, children with atopic dermatitis, but also other complaints like depression, musculoskeletal symptoms, and cancer. The prevalence among cancer patients in Europe varies between 6 and 24% in breast cancer patients. Historically, risk and patient safety have been considered essential in the treatment since the time of Hippocrates, and the dictum to do no harm has been imperative. With the dramatic advance of medical profession over the last 50 years, the topic has received considerable attention, particularly with the introduction of the Nuremberg Code that was established in 1947 to protect individuals from harmful medical experiments. And also the Helsinki Declaration, which is a statement of ethical principles to provide guidelines to physicians and other participants in medical research involving human subjects. The declaration binds the physician with the words, "The health of my patient will be my first consideration." In this research plan, we will work according to the following definition of adverse effects. This includes all diseases and unwanted and harmful reaction appearing after taking the medication, whether or not that may be connected to the actual treatment. A concept in homeopathy is homeopathic aggravation, as you know, which is describing as a temporary worsening of the existing symptom following a correct homeopathic remedy. It indicates that the individual is responding to the medication by generating or increasing symptoms, which is seen as the body's way of coping with illness and part of the healing process. It is understood as a favorable response to treatment and is expected to be followed by an improvement. According to conventional medicine, the worsening of the patient's symptoms as a consequence of treatment is understood as adverse effect. Consequently, homeopathic aggravation is a part of adverse effect in conventional medicine, as you can see here. No, sorry. Is this a red one? Yeah, here you can see that homeopathic aggravation is a part of adverse effect. However, homeopathic aggravation, according to homeopathic theory, is an independent. No, I'm not so good at this. It's an independent concept from adverse effect, as you can see here. So here's a case. A severe case example from homeopathic treatment in which the ethical dictum to do no harm was heavily violated was a case where a 9-month-old baby was admitted to hospital after homeopathic treatment. She was given several homeopathic remedies to treat atopic dermatitis. The child developed bullous pemphigoid during the treatment period that lasted for 5 months. When she arrived at the hospital, the situation was life-threatening. She had general tense blister and crusts, and lesions also affected the face, the hands, and the feet. And you can also see the lack of subcutaneous fat and the skin hanging in loose folders on the trunk and abdomen here. The reason for not sending this baby to conventional care was that the homeopath considered a worsening of the symptoms as homeopathic aggravations. This case illustrates that even though homeopathy is regarded by many as non-effective and a harmless intervention, homeopathic practice may not be entirely risk-free, even though many patients use it with high satisfaction. So, in order to improve knowledge in an unexplored area of safety, 4 groups interview were performed where we want to explore 1, how homeopaths distinguish between homeopathic aggravation and adverse effects, and 2, how they assess patient safety in clinical practice. The aim was to develop criteria that distinguish homeopathic aggravation from adverse effect, and based on the homeopaths themselves on how they reflect on this in the discussion. A qualitative approach was employed using focus group interviews. Oh, yeah. The rationale for this choice of method was that quality study may contribute to a deeper understanding of important health issues. Is there? I can go. I can do it myself. It's okay. Yeah. And here we have the participants. During the winter 2011, we performed 2 group interviews with 5 classical homeopaths in one group and 6 in the other group. They were classical homeopaths without medical school, but trained in homeopathy, and they have a minimum of 4 years education. The number of participants were almost equally divided between men and women, and most of them were located nearby the largest city in Norway. And they have practiced classical homeopathy for nearly 24 years on average. And as you know, classical homeopaths provide individual treatment and prescribe 1 remedy at a time, and possible reactions are monitored carefully to decide on the direction of the healing process. And 7 of them spent 90 minutes with the patient in the first consultation, and 3 of them spent 1 hour. And as you can see from this table, they also choose and offer the patient a lot of additional therapies like acupuncture and neutral therapy and magnetic field therapy. And the medical homeopaths, in Norway it's very few medical homeopaths, and we identified 20 of them. And 4 women and 3 men accepted the invitation. They were medical doctors with additional homeopathic training. They started their homeopathic training during or shortly after having graduated from medical school. And the reason for starting practicing homeopathy was a successful personal or close relatives' experience with homeopathy. And they practiced homeopathy in addition to conventional medicine, and have done so for 16 years on average. And the first homeopathic consultation with patients, they used from 30 to 90 minutes. And they also offered a lot of additional therapies, such as acupuncture and mindfulness. So in the following slides, I will present to you the main findings from these interviews. When asking the homeopaths what kind of experience they have had with aggravation, they claimed that homeopathic aggravation was something they often observed in clinical practice. One homeopath said, "An aggravation is a positive reaction from the body on the remedy you have given. A change is initiated by systematic responses. First there is the reaction, and then comes the improvement. This all depends on how healthy you are." According to the homeopaths, Conditions such as eczema, arthritis, and suppressed feeling was most prone to deteriorate. The homeopaths argue that in order to be a true homeopathic aggravation, the worsening of symptoms must be followed by a feeling of well-being that emerged after 3 to 4 days. According to the homeopathic theory, well-being is understood as better sleep, feeling more energetic, and more balanced. And when we ask them, do you think homeopathy can cause adverse effects? A female expressed, to me this seemed somewhat problematic, and I do not think that homeopathy can remedies cause adverse effects. Adverse effects are side effects caused by a substance given to the body, which causes symptoms similar to those of toxins. This is not the way homeopathy works in my world. One explained, if the deterioration is worse than the person's initial symptoms, there is reason to be alarmed. Then there is an adverse effect. Another said, I'm convinced that homeopathy can give positive effects, and everything that can give positive effects will also give negative effects. Don't you agree? When using it incorrectly, it may be negative effects. And based on the interpretation from the focus group discussion, there were disagreements among the homeopaths regarding adverse effect of the treatment. Some homeopaths found it unlikely that homeopathy and homeopathic remedies can cause adverse effects, as homeopathic remedies are ultramolecular and do not produce toxins. Moreover, some found it difficult to define homeopathy according to orthodox medical treatment system and use the term adverse effect. And others argue that homeopathy can cause adverse effect if the remedy is prescribed incorrectly. So consequently, one can probably say, as a hypothesis, that the homeopaths who found it unlikely that homeopathic remedies can cause adverse effect understand patients' deterioration as a separate from adverse effect and are more influenced by homeopathic theory. Whereas the homeopaths who argue that homeopathy can cause adverse effect are more influenced by conventional medicine. When the participants reflected on adverse effect, they suggested that highly sensitive persons hold an unique position in that regard. These patients are very sensitive to stimulations due to a highly responsive nervous system. They are therefore important to identify to prevent risky situations to occur. One homeopath described them like this. Then there are the hypersensitive who have more adverse effect than all the others together. These are the patients who are complicated to treat. The patients are in a special category as we must identify them in order to help them. Hypersensitive people are generally very easily influenced. They react to all the remedy they are given, whether the remedy is appropriate or not. When a homeopath reflected on adverse effect, a concept called disruption was revealed. A disruptive reaction is a reaction following an incorrect remedy. This causes disappearance of some symptoms and creation of new symptoms. In order for this to happen, the patient must be sensitive to the medication, and is frequently seen in clinical practice. In order for this to occur, the patient must be sensitive to the medication. One homeopath described a personal experience with homeopathy. He said, I was extremely depressed over 6 weeks following a cure of sulfur 1M. And another participant explained, this is a good example of an incorrect remedy, but it touches you, so it's very close. A male participant continued, however, what you may find from a disruptive reaction is the correct remedy. This gives you an unique possibility to understand, because you know that the first remedy was incorrect. According to the homeopaths, a warning sign was when the aggravation became worse than the patient's initial symptoms, which indicates that the symptoms had moved from a superficial to a deeper level, which demonstrates a deterioration of the case. One homeopath explained, It's a matter of understanding the condition, to understand what goes on in the body, understand what's happened to the patient and be able to assess this. Then try to find a remedy accordingly to the patient's level of health. Then choose the appropriate dose accordingly and understand what prevents recovery. There may also be some obstacles to cure. So, how do homeopaths evaluate risk in clinical practice? When analyzing the data from these interviews, we found that the lay homeopaths evaluated complex patient information to separate homeopathic aggravation from adverse effects of the treatment. In that regard, they evaluate the patient's symptoms according to the hearing law of cure, which is a way of monitoring the patient's symptoms according to severity. Interpretation from this interview revealed that medical homeopaths evaluated risk from both conventional and homeopathic point of view. They organized the patient's symptoms in a twofold manner. A female explained, "It is not difficult to think two thoughts simultaneously. I can easily perform an interview as I'm thinking of what remedy is suitable. Sometimes it strikes me, are there any red flag here? I may prescribe a homeopathic remedy and an X-ray requisition to make sure that I do not ignore anything." So based on the data from these interviews, our research group developed some criteria that may guide homeopaths when distinguished between homeopathic aggravation and adverse effects. In response to treatment, the homeopaths must decide when the aggravation becomes adverse effect, and if the increase of existing symptoms is followed by headache or fatigue or both, or the symptoms last for more than 3 days without a feeling of well-being, then there is an adverse effect. Or the deterioration becomes worse than the patient's initial symptoms, indicating that the symptoms have moved from a superficial to a deeper level. Then there is an adverse effect. According to homeopathic theory, the treatment may give rise to adverse effect when an incorrect remedy is prescribed, or the remedy was correct, but the time of the dilution was incorrect, or it was a close remedy match, which results in a disruptive reaction. And some of the criteria developed are also applicable to other healthcare providers. When analyzing the case, the healthcare providers, including homeopaths, must evaluate the patient's general condition, including social network and possible obstacles to cure. Consider the normal development of the disease, which require in-depth understanding of pathology, and they must identify sensitive persons. 2 minutes? Oh my God. Well, you just have to skip half I just have to skip half the lecture then. Okay. I just want to show you something then. Here. Data from systematic reviews reveals that direct risk in homeopathy is found to be low, as adverse effect from homeopathic remedies varies between 2 and 11%. And please have a look at this figure. This figure demonstrates that direct risk, no, I don't have, I mean, direct risk is something in homeopathy that is connected to the remedy. And indirect risk is something that is connected to practice. And direct risk in homeopathy is then to the remedy. And we found that the remedy of low direct risk in homeopathy is only possible for remedies of low dilutions, as they have pharmacological effect. But they also have, remedy of low dilution also have imposed indirect risk due to practice. However, remedy of high dilutions as you can see here, remedy of high dilution, they don't have a pharmacological effect. As they do not have pharmacological effect, and as long as we stay within the pharmacological model, we cannot, however, be sure that the pharmacological model is the correct model to apply, but that is not the topic for this this presentation. And the risk related to high dilution remedies is therefore indirect, also according to homeopathic practice. And a big part of indirect risk in homeopathy is the evaluation of a homeopathic aggravation. I also want to show you the iceberg model. Hemingway have had a style of writing that referred to as an iceberg theory, in which the written word are a story focusing on surface facts, those easily seen. However, beneath and behind the word is a more complete structure supporting the theory, their story. In this presentation and the research plan, the iceberg model has been connected to the theory about the natural history of disease. And in this way, the model can be connected to individual health issues. The model emphasized that minor symptoms are common. They may, however, represent more severe and different diagnoses, much like the unseen part of the iceberg that is much larger than the upper part that is visible over the water, as you can see here. For example, a patient who visits a homeopath with a cough, shortness of breath and breast pain, and is diagnosed with bronchitis, which is the top of the iceberg, since the patient is later diagnosed with lung carcinoma. The iceberg model suggests that an awareness of potential serious differential diagnosis is mandatory for a practicing homeopath, so that the patient is transferred immediately to the conventional care if the first sign of a red flag situation occurs. Then I will just go to the conclusion here. Ska vi se. The concept of homeopathic aggravation may impose a particular risk, as it allows the health status of the patient to deteriorate before there is an improvement. It is therefore important for homeopaths to develop an awareness and look for severe symptoms to avoid ignoring serious events, and to decide whether further examination is necessary. This risk may, however, be controlled for by increased collaboration between primary care providers and non-medical homeopaths. Both lay as well as medical homeopaths assess the patient risk precisely according to the guidelines developed in this research plan. Data from these studies demonstrate that high medical and homeopathic skills are required to assess patient risk accordingly, which is heavily dependent on homeopathic training and education. Consequently, there is a considerable potential for risk related to homeopathic practice due to the current vague legal regulation for the profession. And I do hope that these results will contribute to increased patient safety in homeopathy. And thank you for your attention.
Right. We have time for a couple of questions here.
Hi, Alex Tournier from the HRI. Thanks, Trine, for your great lecture on safety. It's a big topic that we really need to address in homeopathy. I have two questions for you. One is this going to be published, or are you publishing this, or is it published? Or?
Yeah, it has been published in Forskning med komplementär medicin and BMC, Alternative and Complementary Medicine.
Great, great.
Yeah.
And then I just wanted to mention quickly that you probably know about the Posadsky study that was made by Ernst.
Yeah.
End of last year, which showed that homeopathy was terrible in terms of safety. I just wanted to say that we are in the process of redoing that analysis, and it's nearly finished. And when we analysed the cases, most of what came out was allergic type reactions. That is, most of the cases that came out as really due to homeopathy are allergic type cases in low dilution potencies.
Yeah,
so.
I know that. Yeah.
Yeah, it was just realizing it completely to, yeah.
Hi, a question for you. The case of the child that you showed us, wasn't that more of a case of extremely bad judgment from an individual homeopath than a question of homeopathic aggravation? I don't think there was a proper example of homeopathic aggravation.
It was not an example of homeopathic aggravation, but it was an example of indirect risk in homeopathy that is caused by a homeopathic practice. So indirect risk it was, I think. Yeah.
Last question.
Thank you, Trine. Just more a point of information.
Yeah.
I know of only one systematic study of indirect risk in homeopathy, epidemiological study, which hasn't yet been published, but I have seen the result. And it was linked to this EPI3 I showed, the musculoskeletal. They also did a cohort in psychological patients, and they were looking for missed opportunity. And in this was suicide risk, actually. And they showed there is no missed opportunity. There was no evidence of increased risk of suicide or self-harm in patients who received homeopathy. I think it's the only, that I know of, the only prospective epidemiological study of that.
I just want to say that my concern is that as the law in Norway and also in Sweden, everyone can practice homeopathy. And I think that to be a trained homeopath, you need to deviate between homeopathic aggravation and adverse effect. And for that, you need in-depth knowledge in homeopathy and medicine. So that's the risk in homeopathy, I think, is the legal regulation, because everyone can treat.
Thank you very much. Please thank Trine Stub.